The dental chart for our dental patients is probably one of the most difficult things that we get asked about. How do you do the dental chart? When do you do the dental chart? Who does the dental charting? And just a myriad of questions regarding this particular part of the whole dental service. And so we're going to cover all of those questions, hopefully, on keeping a comprehensive dental record for your patients. And the dental chart really needs to be very comprehensive, yet concise, so that it's easy to read, easy to put together, so it's not a very huge time-consuming process, but it needs to give us the whole picture on our dental patients. And I get a lot of records sent to me from our referring vets. With us doing a referral practice, we get a lot of records sent to us, and I see a variety of different dental record keeping. Some are good, some not so good, but I think that we can always, improve and do it better. But my goal is to make this an easy part of the dental service to implement and kind of streamline everything, so it's not as cumbersome as what it can be. Writing those dental records sometimes can be really, really time consuming, and depending on how you're doing it, your day is already pretty full. So we want to make this as easy as possible, yet get all that information down in a reasonable amount of time. I do see some of these records come in within their normal record taking, and in between those exams I'll just see kind of a little sticker, those little dental stickers that are out that are really tiny, and those are I would discourage those being used. They're just too small, and they don't contain enough information, and trying to get all of that information on there can be next to impossible because there's just not enough room. So I'm going to show you examples of the dental charts that we use in our practice, and the process itself on how to do a concise, complete, quick dental chart. So let's look at the role of the dental chart. What do we need to have on this thing to give us a good report? Well, particularly with our periodontal patients, as we all know, periodontal disease is progressive. It's not something that we cure and we're done with. It's something that we have to manage, that we treat over and over again. And so with these periodontal patients, we want to make sure that we're mapping out exactly what's going on with these patients from procedure to procedure. Are we holding steady with those periodontal pockets? Are the periodontal pockets progressing? Do we have more bone loss now than we did last time? Or is the bone regrowing in that area, and are we getting the results that we want? Or do we need to do something different?